Good day, I am Isdeme Del Rosario from BSN 111B Group 6, and today I will perform skin assessment return demonstration. Good day, I am Isdeme Del Rosario, a student nurse from Davao Doctors College Incorporated. So I am just going to close the door to ensure your privacy, ma'am. So can I just confirm that you're Elsa Sanchez?
Yes, ma'am.
Okay, so how would you like me to call you?
Miss Elsa.
Okay, Miss Elsa. Just for verification, may I ask again your full name, please?
I am Elsa Sanchez del Rosario.
When is your birthday?
July 8, 1981.
How about your age?
I'm 40 years old.
Okay. So today, Miss Elsa, I will conduct a skin, hair, and nail assessment. So I am going to palpate and inspect your skin, hair, and nail to look for any changes or abnormalities that might provide us with information about your current health status. So I would like to ask for your consent if it is okay if I touch some parts of your body. Is it okay with you?
Yes, ma'am, it's okay.
Okay, so don't worry, Miss Elsa. All the information that will be gathered in this assessment will all be kept confidential. So do you have any questions or clarifications regarding this assessment?
No, ma'am.
Okay, so if you have any questions or if you feel uncomfortable, feel free to raise your concerns, okay?
Yes, ma'am.
Okay, so may I just ask, are you comfortable with your seat?
Yes, ma'am.
How about the temperature? Are you comfortable with the temperature? Do you want me to adjust the temperature?
No, it's okay, ma'am.
Okay, so you're all good.
Yes, ma'am.
Okay. So before we proceed, I am going to ask some questions about your current condition of your skin. This is for me to gather information that is useful to address your current health issues. So, are you experiencing any current skin problems such as rashes, lesions? Do you experience any of this?
No.
How about dryness,
No, ma'am.
oiliness,
No, ma'am.
swelling,
No.
any bruising or any changes in skin coloration?
No, ma'am.
Okay. How about your hair loss? How about your hair? Do you experience any hair loss or any change in your hair?
No.
Okay. How about your nails? Is there any changes in the appearance of your nails?
No, ma'am.
Okay. Do you have any birthmarks or moles?
Yes, ma'am.
Do you have moles? Or,
Yes, ma'am. I have one.
may I know where it is located?
Here.
Oh, okay. Have you observed any changes in shape, size, or color?
No.
Yeah, okay. How about birthmarks? Do you have any birthmarks?
Yes, ma'am.
Oh, may I know where it is located?
Here at the right arm.
Okay. So may I know, has it been infected?
No. No po.
Okay. Do you feel any pain, itching, tingling, or numbness in your skin?
No.
Okay. Do you have any trouble controlling body odor?
No, ma'am.
Okay. For your personal health history, have you ever had any allergic reaction to food, medication, plants, or in your environment?
Food. Yes, ma'am.
Oh, what kind of food?
Poultry, like egg or chicken.
Okay. So you're allergic to poultry food. So
Yes.
what reaction do you usually experience when this allergy occur?
Itchiness and dryness.
Okay. Are you taking any medication for your allergy?
Yes, ma'am.
What medication?
One tablet of cetirizine.
Okay. When was the last time you had an allergic reaction?
A month ago.
Okay. So may I ask, are you pregnant?
No, ma'am.
How about your menstrual period? Is it regular?
Yes, I'm regular.
Okay. So for the family history, has anyone in your family had recent illness, rash, or other skin problem?
No, ma'am.
Okay. Has anyone in your family has skin cancer?
No, ma'am.
Okay. Do you have a family history of keloids?
No. No.
Okay. So for your lifestyle and health practices, so in your daily activities, are you regularly exposed to chemicals that may harm your skin?
No, ma'am.
Okay. Do you have a daily routine for your skin?
Yes, ma'am.
Okay. Can you describe it to me? What you usually use?
I take a bath every day. Then after that, I put lotion in my skin.
Mm-hmm. How about your hair? What do you usually do to your hair?
To my hair, I wash my hair every day with shampoo like Palmolive. Then after that, I put conditioner.
Okay, so how about your nails? What do you usually do to take care of your nails?
My nails, I cut in shirt.
Okay. So what kind of foods do you usually eat on a typical day?
In a breakfast, egg, hot dog, bread, coffee or milk. Then for lunch, um, vegetables with fruits. And for dinner is soup.
So, okay. How much fluid do you drink on a daily basis?
2 to 3 liters a day.
Okay. Do you spend long periods of time sitting or lying in one position?
No.
Okay. So do you have any body piercing?
Yes, ma'am.
Oh, so may I know where it is?
Here, at my ears.
Okay, I see. Okay. When did you have your body piercing? I mean your ear piercing.
When I was young.
Okay. How about tattoos? Do you have any tattoos?
No po.
Okay. So that's it for our history taking. So before we start to the assessment, can you please change into this examination gown? Also, kindly remove all the jewelries, nail enamel, artificial nails or wig. So this is for me to collect accurate result to your assessment. So, okay, can you please change in that? So, Miss Elsa, I will now start the assessment for your hair, skin, and nail. So, I am going to assess in a cephalocaudal manner, meaning I will be assessing from your head down to your toe. So, now I am going to assess first your hair and scalp. So, I am going to touch your hair and scalp. Is that okay with you?
Yes, ma'am.
Okay, so what I am doing now is I'm inspecting and palpating the hair and scalp at 1 inch interval. So I am checking for any depressions on the skull, balding spots, or any hair loss. So I am also assessing for the cleanliness, dryness, or oiliness, and parasites or lesions. Okay, on the other side. Okay. So may I ask if you dyed your hair or colored your hair?
Yes, ma'am.
Okay, so when did you color your hair?
Last year.
Okay, so I'm going to check at the back portion. Okay. Okay, so I observed that you don't have any depressions on your skull, which is a good thing. I also don't see any lesions or scars or any parasites in your hair. And also, the scalp is clean and dry. The hair is smooth and firm. And I can see thinly distributed dandruff, which is still considered normal. I also observed that your hair is evenly distributed on your hairline, eyebrows, and eyelashes. However, I can see some discoloration in your hair, probably because you colored your hair as what you said earlier. All in all, I can observe that your hair and scalp's condition is healthy and normal. So now, I am going to proceed in skin assessment. But before that, I am going to remove my gloves so that I can properly assess the condition of your hair. Okay? Just gonna do this quickly. Okay, so I am going to inspect your skin, Miss Elsa. So, is that okay with you?
Yes, ma'am.
Okay, may I have your arm, please? This one first. So now I am observing your skin color variation. Generally, I can observe that your skin color is light brown and is consistent. Okay. Okay, may I have your other arm, please? Okay, so I observed that this area is a bit more brownish compared to the rest of your skin. So you've said that this is your birthmark. So have you observed any change in your birthmark?
No one.
Have you experienced bleeding or irritation in your birthmark?
No po, ma'am.
Okay, so I'm just going to measure your birthmark. Okay. Okay, so if you do experience any complications in your birthmark, make sure to see a physician, okay?
Yes, ma'am.
So I can observe that you have an even pigmentation except in the area in your birthmark. I don't see any presence of jaundice or yellow-orange pigmentation, which may indicate any illnesses including hepatitis, gallstone, or tumor. I also don't see any reddish or darker rashes or any redness that may indicate an inflammation or allergic reactions. Cyanosis or a bluish discoloration is not also observed upon assessing your skin. All in all, I can observe that the color variation of your skin is normal, the skin is intact, and there are no skin breakdown, which is a good thing. I am not also noticing any unusual odor perspiration coming from you, which is also a good thing. So now I am going to check for your skin integrity. So may I have your arms again, please? So you've said earlier that you like to change your position from time to time. So I can observe. So I can observe that the skin is intact and there are no reddened areas that indicate pressure sore risk, which is a good thing. Now, I am going to palpate your skin to assess for moisture. May I have your hands again, please? Okay, other hand. Okay, so I observe that your skin is not too dry nor too oily, which means that your skin moisture is good. So now, I am going to assess for the temperature. So using the dorsal surface of my hand, I am going to touch your skin since this area is more sensitive to temperature. So I am going to touch your face. Is that okay with you?
Yes, ma'am.
Okay. Okay. May I have your arms? Just like that. Okay. So I can feel that the skin is warm, which is a normal temperature for our skin. So now I am going to assess the texture of your skin using the palmar surface of 3 of my middle fingers. So I am going to touch your skin again. Is that okay with you, Miss Elsa?
Yes, ma'am.
I'm going to touch your face. Okay. Okay, your hands, please. Okay. I can feel that the skin in your face, arm, and forearms are smooth and even. Your palm is a bit rougher than the rest of your skin. This is usually because of the calluses that are common in areas of the body that are exposed to constant pressure. All in all, the texture of your skin is good and normal. So now I am going to check for your skin mobility and turgor. So mobility refers to how easily the skin can be pinched, and turgor refers to how quickly the pinched skin to return to its original shape. So in checking your skin's mobility and turgor, I will need to gently pinch the skin in your clavicle. Is that okay with you, Miss Elsa?
Yes, ma'am.
Okay, just going to pinch. Okay, so I can observe that your skin is easy to pinch and the pinched skin immediately returns to its original shape, which is an indication that your skin is mobile with elasticity, meaning your skin's mobility and turgor is normal. So now I am going to focus on assessing if there is any presence of lesions. So may I have your arms again, please? So based on my observation, I can see that the skin is smooth and there are no signs of any lesions. However, I noticed some moles, which is considered to be normal in shape and size. May I see your mole in the chest, please? I am just going to measure it. Okay, so 3. So have you had this for a while now, or did it just pop up?
I have it since I was small.
Okay, so I also noticed this mole in your hand. How about this? Have you observed any change in size, color?
No.
So if you observe any changes in your mold, any changes in size, color, or shape, make sure to consult to a physician because it might be a cancer cell. Okay. Based on my observation, I can see that the shape and the size of the molds look fine and normal, and no lesion. I don't observe any lesions on your arms, which is also a good thing. Okay. So now I am going to assess for your nails. May I have your hands, please? Okay. So now I am looking at your nail color, shape, and if there is any signs of clubbing or any lesions or cyanosis. So I can observe that your nails are cleaned and groomed properly. I can also see that your nails are in pink tones, which is considered to be normal. Okay, so can you please do this, Miss Elsa, like that? Okay, so I can see that there is a 160-degree angle between your nail plate and skin, which is normal. So may I have your arms again, please? So now I am going to palpate on your fingers. Okay. So I can feel that your nails are hard and immobile. The texture of it are smooth and firm, which is a good thing. So now I am going to test for capillary refill. So I am going to pinch the tip of your nails. Is that okay with you, Miss Elsa?
Yes, ma'am.
Okay, may I have please? How about on the other side, please? Okay, so the pink tone returns immediately when the pressure is released, which is considered to be normal. Lastly, I am going to assess for lesions or presence of edema in your lower leg. So, may I have your lower leg, please? Okay. Okay. So I can see that there is no presence of lesion. Okay, the skin is smooth and firm, and the skin feels warm, which is normal. So I am going to gently press down your skin. Is that okay with you, Miss Elsa?
Yes, ma'am.
Okay. This is to test for any presence of edema. Okay, no indentation is found, meaning there is no sign of edema. So may I have your other leg, please? Okay, no lesion is also observed. I can also see, okay, no lesion is also observed. The skin is smooth and firm, and the skin feels warm. So I am also gonna press your skin. Is that okay with you,
Yes,
Elsa?
ma'am. Yes, ma'am.
Okay, I'm just assessing for any presence of edema. Okay, so I don't see any presence of edema. Okay, so you may. Okay, so I don't see any presence of lesions on your lower leg. So your skin also, when pressed, is not showing any signs of edema because there is no indentation that occurs. So we're done with the assessment. I'm just going to take down all the things I've observed, okay? Okay. Okay, Miss Elsa. I will now sum up everything that I've observed throughout this assessment. So I will sum up everything now, Miss Elsa. So I observed that your skin and skull condition is healthy and normal. There is no depressions on the skull, no balding spots, no lesions or any scars, and no parasites was observed. For your skin, I observed that you have uneven pigmentation, except in the area where your birthmark is located. No signs of jaundice, redness, or cyanosis throughout the skin. Your skin feels warm, smooth and even, and the mobility and turgor is normal. So there is no sign of any lesions. And edema, also I observe some moles, which is normal in shape and size. So for the nails, I observed that the nail is cleaned and groomed properly. No signs of lesions or cyanosis upon the assessment. So the color, shape, and texture of your nail are all normal. So in the capillary refills, the capillary refills are also normal since the pink tones in your nails immediately returns in less than 2 seconds. All in all, I can observe that your skin, hair, and nail is all normal. And if you ever notice any changes in your birthmark or moles, make sure to see a physician, okay? And I can also endorse you to a dermatologist to further examine your birthmarks because they are quite huge in size. All in all, your skin, hair, and nail condition is fine. So am I clear, Miss Elsa, or do you want me to repeat the whole information gathered?
Here, ma'am.
Okay, clear? Okay, so that's it, Miss Elsa, for our assessment for today. We will just contact you if we have further follow-up assessment. So before we end, do you have any questions or
No.
clarifications?
No, ma'am.
Okay, so thank you so much, Miss Elsa, for cooperating and have a good day.
Thank you, ma'am.